This video will explain how doctors treat a heart attack. First, we will see what is a heart attack. Heart attack happens when blood flow to the heart is blocked, usually because of a blood clot or fat buildup in the heart arteries. Without a quick treatment, part of the heart muscles can get damaged. Now we will see step by step how doctors treat a heart attack. First step is emergency response. When someone arrives at the hospital with chest pain, shortness of breath, or sweating, doctors act immediately. They check vital signs, including pulse, blood pressure, and oxygen levels, to assess the patient's condition. An ECG is done to see if the heart is having heart attack by measuring electrical activity. Blood tests are also taken to detect specific markers that indicates heart muscle damage. Second step is immediate medicines. Doctors quickly give medicines to stabilize the patient and prevent further damage. The doctor used to give medicines like aspirin to thin the blood and stop clot from growing larger, nitroglycerin to relax blood vessels and reduce chest pain, oxygen if the patient is low on oxygen to support breathing, blood thinners to stop new clots from forming in the bloodstream. Third step is opening the blocked artery. The main goal is to restore the blood flow to the heart as fast as possible. There are two main approaches. The first one is angioplasty and stent. The second approach is clot-busting medicine. First, we will see angioplasty and stent. A small tube called catheter is inserted through the arm or leg artery. Doctors use it to reach the blocked heart artery. A balloon at the tip of the catheter is inflated to push the blockage aside. A small metal tube called stent is placed to keep the artery open. The next one is clot-busting medicine. These medicines dissolve the clot in the artery, used mostly when hospitals don't have angioplasty facilities available quickly. Fourth step is other treatments, if needed. First one is bypass surgery. In severe cases, doctors create a new path for blood to flow around the blocked arteries using blood vessels from other parts of the body. The second one is defibrillator, which is nothing but electric shock. If the heart stops or beats irregularly, doctors may use an electric shock to restart it and restore normal rhythm. Fifth step is hospital recovery. After the emergency treatment, patients enter a critical recovery phase. Patients are kept under close monitoring for several days to watch heart functions and vital signs. Medicines are given to lower cholesterol, control blood pressure, and prevent clots. Healthcare team provides advice on quitting smoking, maintaining a healthy diet, and safe exercise. Sixth step is long-term care. Patients must continue regular medicines to protect the heart and prevent future attacks. Cardiac rehabilitation programs help with safe exercise routines and comprehensive recovery. Regular doctor visits are essential to monitor heart health and adjust the treatment as needed. Now we will see the final thought. Treating a heart attack is all about speed. The faster doctors restore blood flow to the heart, the more muscles can be saved. In simple words, doctors stop the clot, open the blocked artery, support the heart with medicines, and guide patients towards long term recovery.